In Palestine, the health situation is worsening in the Gaza Strip. Shortage of basic supplies leads to increases in hepatitis cases and higher risk of infections. More details in the following report.
The Palestinian population in Gaza is currently facing high sanitary risks due to the devastation caused by the ravages of the attacks and the destruction of most of its hospital centers, combined with the scarcity of basic supplies such as food, water, and fuel.
The
word misery is not enough, the word suffering is not enough, the word trade is not enough. This people has never fallen. It has always had its head held high, from its beginnings, from its ancestors, its great-great-grandparents and grandparents and all its generation. We only bow down before our God. We only kneel in our place of prayer. Our suffering starts from childhood. My child suffers, my neighbor's child suffers, my partner's child in the tent suffers. Besides, the environmental situation is extremely deteriorated. Here, the children have intestinal infection every day. There are all kinds of diseases. Hepatitis has proliferated in an impressive way. There are 20,000 to 30,000 cases.
At least 1.5 million citizens are refugees in the border town of Rafah, crammed into United Nations educational centers and improvised tents.
I was displaced 4 months ago to Dahi, then from Dahi to Han Yunis, and then from Han Yunis to Rafah. That is to say that I am displaced several times. Life here is very, very hard for us. Later, the heat will come and may God help us. I call on all the Arab countries to support us and to stop this injustice that is being committed against us, because we are really tired of it. Our situation is too difficult. There is no food or medicine or anything. There are no basic elements to survive.
Meanwhile, the International Court of Justice on Thursday ordered Israel to ensure without delay the delivery of urgent humanitarian aid to the Gaza Strip. According to the UN's highest court, Tel Aviv must take all necessary and effective measures to ensure the unimpeded provision of basic services and humanitarian aid.
We have a final short break coming up. Before